helping make your life easier. Moms Every Day.
Hey, welcome to Moms. I'm Hattie Cheek. We have Dr. Amanda Arrington here with us today from Huntington Hospital. Now, you're a surgical oncologist. We were just talking about October being Breast Cancer Awareness Month. Everyone's got cancer on the brain, so it's appropriate to talk about this right now. So, surgical oncologist. What exactly does that mean that you do, and what is your role when it comes to cancer treatment?
Well, surgical oncologist is a board-certified general surgery surgeon, so we went through general surgery residency, and then we took extra training, 2 or 3 years of a fellowship, and now can be board-certified as well in cancer surgery, so a specialization specifically with cancer surgery. What does that mean? It means I work hand in hand with the other cancer doctors, the chemotherapy doctors, the medical oncologist, the radiation oncologist, and the pathologist to come up with a treatment strategy for each and every patient that we see.
Okay, and then when it comes to performing surgeries, in your opinion, why is it better to see someone like you, a surgical oncologist, versus a general surgeon?
Well, as a surgical oncologist, I was trained not only in the specialized cancer surgeries, some cancer surgeries that general surgeons aren't trained in, as well as I have a special higher knowledge of tumor biology itself.
Okay.
So adding those together, we can come up with hybrid techniques, combination surgeries, treatment strategies for all of our patients.
And you said you're trained in more cancers. You know more about that. You're trained to do more surgeries than just a general surgeon is. So what kinds of surgeries do you do?
Well, I treat a variety, a very large spectrum of cancers, including melanomas, sarcomas, GI cancers, stomach, colon, breast cancers, including minimally invasive cancer surgeries, robotically assisted surgeries, as well as directly using chemotherapy within my surgery.
It's almost like you're always doing surgery. So you're seeing patients from all different spectrums, with different size tumors, different needs, different things going on. They're at different places in their treatment. Now, when they get their surgery, after it, do they have to go through radiation? What is that process like after the surgery?
Well, cancer isn't a one-shop stop.
Right.
Every patient, every cancer is different.
Right.
Some people need chemotherapy before surgery. Some people need chemotherapy after surgery, radiation after surgery. It's our job as a multidisciplinary group at Edwards Cancer Center to work together to figure out which treatment strategy for each patient is going to be appropriate. So yes, many patients will need chemotherapy before or after. Sometimes in early stage cancers, such as colon cancer, treatment is surgery alone, which goes to talking about prevention and screening and finding cancers early.
Now, I'm sure you have to do some kind of monitoring process before you would go to do surgery. Is there any kind of cancer that is just you shouldn't do surgery?
There are some cancers that chemotherapy and radiation work very well with, and surgery should be a last option, including lymphomas, leukemias, and even certain types of lung cancers.
All right, and then most surgeries that we're hearing about today, we're hearing about the small incisions. Is that the approach that you take, or does it vary?
It varies with every patient and every cancer. A lot of the GI cancers now, the stomach cancers, the colon cancers, can be performed safely and efficiently with minimally invasive techniques, which is, for example, laparoscopic surgery with a camera and small incisions. I do perform those surgeries on the right patient that can tolerate those surgeries. We can even use a robotically assisted surgery to increase the areas that we can work on with the small incisions.
Now, I have to imagine that it's beneficial to the patient, and when you hear minimally invasive, that's kind of obvious. But for you, is it more difficult to do it that way?
It is. once you get used to it, laparoscopic surgery and robotically assisted surgery is just as is actually easier on many surgeons.
Wow.
And you get more. You can do the surgery quicker, and it's safer for the patient. It leads to shorter hospital stays and potentially shorter recovery.
All the benefit for the patient. Doctor, thank you so much for being here. If you need any more info, you just head to our website, WSAZ.com. Click on the Moms Everyday tab. You'll be able to rewatch the interview. There was a nice little graphic there that had the information on how you can get in touch with the doctor. And we also have a new Moms Everyday app. It's got a lot of meal options for you. Thanks for being with us.